Hello students, so today we are going to deal with yet another topic, that is care of the patients with special needs. So in a clinical, diagnostic and functional development, special needs refers to individuals who require assistance for disability that may be medical, mental or psychological. So we can say this special needs people, they are those individuals who basically require assistance. Special needs. Special need is being provided to these kind of persons who require assistance, right? So, assistance for disability. Disability, it can be medical, it can be mental or it can be psychological. So, any of these condition persists, the person may have this, we can say this assistance is required, and those person, they are the person with the special needs. Okay, so in clinical, diagnostic and functional development, special needs or additional needs, it refers to those individual who requires assistance for disability. Disability, it can be medical, it can be mental or it can be psychological. Special needs can range from people with autism, Asperger's syndrome, cerebral palsy, Down syndrome, dyslexia, dyscalculia, dyspraxia, dysgraphia, blindness, deafness, ADHD and cystic fibrosis. So we can say this special needs, it basically they can range from, we can say, people with either autisms, Asperger's symptoms, ADHD children's, Down syndrome, dyslexia, dyscalculia, these all are the special needs children. So if required, they need assistance to carry on their work. Now, what is the definitions of this? First is patients with special needs. They include individuals who are disabled due to physical limitations. Physical limitations, it can be congenital, it can be traumatic or physiological. So we can say this patients with special need individuals who are basically disabled. Why disabled? It can be because of physical limitations, it can be congenital, it can be traumatic or we can say physiological. Then any medical complications which include systemic, acquired or hereditary. So any, we can say, medical complications which includes any systematic, acquired or hereditary. Any developmental problem, which includes congenital or acquired. Any cognitive impairment which includes mental, sensory and emotionals, that requires medical management programs. So these all situations which requires or which comes under this criteria, they are the special needs persons. So patients with special needs, they includes individual who are disabled due to physical limitations or medical complications or developmental problems or cognitive impairment that requires medical management programs. Those are called as the care of special needs person. First is temperature. Okay. So body temperature is the heat of the body measured in degrees. The degree of the body temperature reflects the difference between heat productions and the heat loss. So what does the body temperature refers to? Any temperature that is being maintained by our body. We used to say the temperature. So body temperature is the heat of the body. It is our heat of the body, which is basically measured in degrees. How the body temperature is measured? It can be measured in degrees also, it can be measured in Fahrenheit also. The degree of the body temperature, it reflects the difference between heat productions and heat loss. How much heat has been produced and how much heat has been lost from our body. The core body temperature of a healthy person is maintained with a fairly constant range by thermoregulatory center in the hypothalamus. So this temperature is being maintained basically by the thermoregulatory center that is being situated in the hypothalamus region. Normal body temperature is 37 degrees Celsius. Normal person's body temperature is 37 degrees Celsius, which is 98.4 degree Fahrenheit. Regulations of body temperatures. So, balance of body temperature is a physiological mechanism and is regulated by physiological and behavioral phenomena. So, we can say this our body temperature is basically balanced it's basically a physiological mechanisms, and is basically regulated by the physiological and the behavioral phenomena. First is in this neural control. So hypothalamus is the brain control body temperature. When body temperature deviates from the normal, hypothalamus activates heat loss and heat production. So we can say hypothalamus is basically the brain control body temperature, right? So in a case when the body temperature, it just deviates from the normal, and immediately the hypothalamus, it activates the heat loss and heat productions. So impulses from the hypothalamus are sent to the periphery, which causes vasodilations, vasoconstrictions, muscle shiverings, and piloerection, that is the erections of hair. Okay, so we can say in how this neural control is being there, we can say this hypothalamus in the brain, it basically controls the body temperature. When a body temperature is just deviates from the normal, this hypothalamus is basically activates the heat loss and the heat productions, and impulses from this hypothalamus is being sent to the periphery, which basically causes vasodilations and vasoconstrictions, and thus it causes muscle shiverings, piloerection. Piloerection means it is the erections of the hair. Second is thermogenesis. It means chemical regulation by productions of heat. Chemical regulations by productions of the heat in the following ways. First is oxidations of the food. During metabolism of food, heat is produced in the following ways. Okay, so during metabolisms of this food, the heat is basically produced in following ways. The first is 1 gram of carbohydrate, it gives 4 calories. So we can say 1 gram of carbohydrate, it gives 4 calories. In the same way, 1 gram of protein, it gives also 4 calories. And 1 gram of fat, it gives 9 calories. Okay, so this is all comes in the oxidations of the food. So we can say during this metabolisms of the food also, heat is produced in many ways. As we can say, 1 gram of carbohydrate, it gives 4 calories. 1 gram of protein, it gives 4 calories, and 1 gram of fat, it also gives 9 calories. The second is muscle activity. How muscle activity produces the heat? During muscular activity, stored glycogen is converted into sugar and it releases energy causing heat productions. So what happens in the muscle activity? So during the muscular activity, a stored glycogen that is being there in the body is basically converted into a sugar, and then it releases energy which causing the heat production. Third is hormonal effect. Increased activity of the thyroid gland increases basic metabolic rate. So we can say this increased activity of this our thyroid gland, it basically increases the BMR, that is the basic metabolic rate. By breaking down of glucose and fats, that is it breaks the glucose and the fat. So hormonal effect, that is the increased activity of the thyroid gland, it increases the basic metabolic rate. And how? By breaking down of this glucose and fat. Fourth is sympathetic stimulations. Epinephrine and norepinephrine stimulates sympathetic nervous system to increase metabolism. So we can say this epinephrine and the norepinephrine's, it basically stimulate the sympathetic nervous systems, and this increases the metabolism. Fifth point is thermolysis. It means regulations of temperature by heat loss, that is the temperature is maintained by proper heat loss. The heat in the body is lost by radiations, and you know our heat in the body is basically lost by these radiations, conductions, evaporations and convections. So that all will be coming in thermolysis. So thermolysis, it means regulations by heat loss, and the heat in the body is basically lost by radiations, conductions, evaporations and convection method. Sixth point is radiation. Heat radiates from the skin to a nearby objects. We can say this heat is basically, it radiates from the skin to a nearby objects. The amount lost from the skin varies according to dilatations of surface blood vessels when the body is overheated, or by vasoconstrictions when the body is chilled. So we can say our heat is also transferred to other object. So heat radiates from the skin to a nearby objects, and the amount it loss from the skin varies according to the dilatation of the surface blood vessel when the body is overheated, or vasoconstrictions, or when the body is chilled. Seventh is conduction method. So it is the heat loss by the contact of skin with environmental objective like air, water and clothes. So we can say the heat loss that is happens by contact skin with some environmental objects. It can be air, it can be water, it can be clothes. Next is convection method. It is a method of transfer of heat by circulating air or a liquid. That is, it is also one type of heat loss when it is a transfer of heat by any circulating air or liquid. Ninth is some amount of heat loss also takes place through lungs, kidneys and bowels, and some amount of heat loss also takes place via lungs, kidneys and bowel. So these are the various ways by which the heat loss happens in our body. So in temperature, the first is hypothermia. So the temperature less than 25 degree leads to hypothermia. Okay, so how we can define hypothermia? Hypothermia is a condition that is a temperature less than 25 degree, it leads to hypothermia. What are the causes of hypothermia? First is exposure to prolonged cold. That is, prolonged, you are exposing yourself to a cold. Older age, cardiovascular diseases, any cardiovascular disease that you are having it, malnutrition or hypothyroidisms. So these all are the causes of hypothermia, that is exposures to prolonged cold, older age, cardiovascular diseases, malnutrition, hypothyroidism. It is a medical emergency that happens when the body is not able to produce heat and temperature falls at 35 degrees Celsius or even lower. So we can say it is basically a medical emergency that happens when the body is not producing heat, or when we can say the temperature falls to 35 degrees Celsius or even lower. So the symptoms, what are the symptoms of hypothermia? There will be cold and clammy skin, that is, the skin will be very cold and clammy. Second is shivering will be there. Third is mentally confused, the person will be mentally confused. Disturbance of coordination, there will be coordination disturbance. Irregular and slow pulse, that is, the pulse will be very irregular and very slow. So these all are the symptoms, that is cold and clammy skin, shivering, mentally confused, disturbance of coordinations, irregular and slow pulse. Then treatment, how hypothermia can be prevented? First is wipe the point dry. Provide dry sheets, wrap the point in a warm blanket. You have to make sure that first of all you just dry whichever part is exposed, and then you should provide dry sheets, and also you should wrap the point in a warm blanket. Give hot water bottle, you can also provide hot water bottle. Give warm drinks if conscious. You can also provide warm drink to the patients if the patient is conscious. Check the vital signs as required, and then you have to check the vital signs as required. So these all are the, we can say, the things that has to be managed for the hypothermia patients. Next is the management. And the first is rearming. Rearming refers to, it depends on the degree and may involve applying blankets, giving warm fluids, immersing in warm waters, applying heat pads or hot water bottle, instilling warm fluids, applying warmed oxygen, using extracorporeal blood warming. That is everything you are providing in a warm way. So that is warm way, which involves giving warm fluids, immersing in warm water, applying the heat pad using or hot water bottle, instilled warm fluids, apply warm oxygens, or using any extracorporeal blood warming. Second is supporting the vital functions. Third is preventing and treating the complication, that is the various complications that the person is having, you can treat it. So this was all regarding hypothermia. Next we will be learning about hyperthermia. So hyperthermia refers to more than normal body temperature considered according to various conditions of hypothermia. Hypothermia is a conditions, we can say, that is above normal than body temperature, the temperature is raised, that we used to say the hypothermia condition, in which the first is types of fever. First is constant and continuous fever. A continuous fever is one in which the temperature varies not more than 2 degrees between morning and evening, but the temperature does not come to normal during the day. That is, it is a stage, constant or a continuous fever, it is a stage in which the temperature varies not more than 2 degrees, that is in the morning also we checked, or in the evening also we checked. It varies not more than 2 degrees, but the But the main thing is that the temperature doesn't come to a normal during this day. It definitely varies also, but the thing is that it doesn't come to a normal stage also. That we used to say constant or continuous fever. Second is intermittent fever. Intermittent fever, it shows large variations, that is the temperature rise from normal to a high temperature and comes down to a regular interval. So we can say in intermittent fever, it basically shows the larger variations. How? Because the temperature, it just rises from the normal to a higher temperature and then it comes down to a regular interval. Third is remittent fever. In remittent fever, the variation is more than 2 degrees centigrade between morning and evening, but fever does not reach normal. In remittent fever also, the variation is more than 2 degrees centigrade, that is between morning and evening, but fever does not reach normal level. Fourth is inverse fever. In this type, highest temperature is in the morning and lowest temperature is in the evening. In the inverse fever, what is there? That is the highest temperature is basically in the morning time and the lowest temperature is basically in the evening time. Fifth is relapsing fever. In this type, there are short febrile period followed by 1 or more days of normal temperature. So we can say in relapsing fever, there is short febrile period. It is followed by 1 or more days as a normal temperature. So these all are the types of fevers. Low pyrexia, what we used to say low pyrexia, that is 99 to 101 degree Fahrenheit. Moderate pyrexia, that is 101 to 103 degree Fahrenheit. High pyrexia, that is 103 to 105 degree Fahrenheit. Hyperpyrexia, that is 105 degree Fahrenheit and above. Then is management of severe fever. How we will be managing the severe fever if the patient is having it. First is you have to provide oral fluids to the patient, that is at least 3 liters per day. Cold sponging to the patient to reduce body surface temperature. You should provide cold sponging to the patients to reduce the body surface temperature. Give frequent mouthwash and attend to oral hygiene. You should always provide the frequent mouthwash and also attend the oral hygiene. Reduce external covering on the patient's body to promote heat loss through radiations and conductions. That is any external covering, that is any blankets you have put or any bed sheets you have put, you have to remove all that things so that this process of radiations and conductions can be lost. So management is, first is you have to provide the oral fluids 3 liters per day. Give cold sponging to reduce the body surface temperature. You have to give the frequent mouthwash and you have to attend the oral hygiene, and then you have to reduce the external covering of the patient to promote the heat loss through conductions and radiation. Next point is do not induce chills. Next is keep clothing and bed linen dry to increase the heat loss through the conductions and convection method. So you have to make sure that you provide the clothing and bed linen to the patient. Why? To increase the heat loss through conductions and the convection method. Provide cool and circulating air. You should provide a cool and a circulating air to the patients. Limit the patient's physical activity and provide rest. And then you have to make sure that you limit a person's physical activity and provide rest to the patients. Administer antipyretic medication as per doctor instructions. You also have to give the antipyretic medications as being prescribed or as being doctor's instructions. In severe cases, antipyretic injections are given as per doctor instructions. In severe cases, antipyretic injections can also be given to the patients, but as per doctor prescriptions. Check the temperature every half hourly and record to assess the general conditions of the patients. And then what you have to do is, you have to check that temperature every half an hourly and then you have to record to assess the general conditions of the patient. So this was all regarding, we can say, temperature. Temperature, we covers the hypothermia and the hyperthermia state. Next, second is sensorium. Sensorium, that is which includes assessment and management and the care of unconscious patients. So who patients are called as the unconscious? Unconscious are those patients who are not aware about the surroundings, and that is they are not oriented to particular procedure that is happening. They are unconscious. Okay, so unconscious is the lack of awareness of one's environment and the inability to respond to external stimuli. So we can say unconscious is that stage in which the patient is unaware about the situations or one's environment, and the person is inability to respond to the external stimuli. Unconsciousness is a condition where cerebral functions are depressed and the patient has inability to respond to sensory stimuli. So we can say unconscious is basically a condition where the cerebral functions are depressed and the patient has inability to respond to the sensory stimuli, and the patient is not responding to the sensory stimuli. So a coma is a state of unconsciousness in which a patient cannot be aroused even with powerful stimuli. So we can say coma is an example of unconsciousness. It's a state of unconsciousness in which a patient cannot be aroused, in which we cannot arouse the patients even with powerful stimuli. That is the stage of unconsciousness. Care of unconscious patients. Okay, so what are the causes of this unconsciousness? First is head injury. Any head injury can cause severe accidents, and because of severe accidents the patients can have a head injury. Then cerebral catastrophes, infections, because of infections also, then asphyxia and poisons. Okay, so these are the causes of, we can say, unconsciousness. Types of unconsciousness. So unconscious, they can be classified into brief, lasting for few seconds or an hour. First is brief, or which is lasting for either few seconds or an hour. Sustained, lasting for few hours. We can define unconsciousness as, or we can classify as those unconsciousness which is sustained and which is lasting for a few hours. So what are the investigations for the unconsciousness? First is blood examinations for glucose, urine nitrogen and electrolyte. Blood examinations can be done for glucose, to check the glucose level, urine nitrogen level and the electrolyte level. Complete blood count, that is a CBC count, should be done. Lumbar puncture for cerebrospinal fluid examinations. Okay, so lumbar puncture can be done for cerebrospinal fluid examination. Liver function test, X-ray of a skull, then electroencephalography. Okay, so these are the basic investigations we are doing it. Blood examinations for glucose, urine nitrogen and electrolytes, complete blood count, lumbar puncture for the cerebrospinal fluid examinations, liver function test, X-ray of skull and electroencephalography. Treatment. First is respiration should be maintained by patent airway. Okay, so how the respiration should be done? It should be maintained by the patent airway. If a patient is in shock, it should be okay. Next is antibiotic are necessary to treat infections. Antibiotic are necessary to treat certain infections. Sedatives are prescribed for the restless patients, and for the restless patients we basically prescribe the sedatives. Stool softener may be required to prevent constipations. Then specific treatment is started as soon as the diagnosis is confirmed. So specific treatment can be provided to the patients, or it can be started soon as the diagnosis is confirmed. Now what will be the nursing management for this unconsciousness? First is unconscious children require constant observations to detect any changes in the vital functions or early changes of complications. So we can say this unconscious children's, they basically requires constant observations. Why? To detect any vital functions or any changes happening because of any complications. Therefore prompt recording and notifying the doctor is necessary. Therefore at that time prompt recording or notifying the doctor is very much necessary. Educate respiration should be maintained by keeping the patent airway, and then you can also provide the educate respirations by maintaining a proper patent airway. Vital signs should be monitored by keen observations as the following, and then you have to make sure that vital signs is also being followed by having a keen observations of the following. First is level of consciousness including behavioral sign and reflexes. So first is the patient's level of consciousness should be checked, which include the behavioral sign and the reflexes. Hyperthermia can be treated with the cooling measures and the tepid sponging. And this hyperthermia, it can be treated with the cooling measures or tepid sponging. Respiration can be assisted by chest physiotherapy, and this respirations also can be assisted by doing the chest physiotherapy such as percussions and vibrations every 2 hourly. Blood pressure should be monitored. The BP should be monitored continuously. Cerebral edema should be prevented by the accurate use of prescribed diuretics and fluid intakes. So we can say if the patient is having cerebral edema, at that time we can prevent that by using of any prescribed diuretics by the doctors and the fluid intakes. Daily weight may help to assess the overhydrations, dehydrations, and by comparing the weight with the intake and output balance. And then what we can do is, you can just see the daily weight. Why? Because it helps to see the overhydrations or the hydrations by comparing with the actual weight, or we can say the intake and output balance. Raising the head of the bed will help to relieve cerebral pressure. If the patient is raising the head, it also helps to relieve the cerebral pressure. And next is, side rails of the bed should be up to prevent falls. You have to make sure that the side rails of the bed is up so that it prevents the falls. Pressure sores can be prevented by regular skin care. The pressure sore, it can be prevented by regular skin care. Bowels should be kept in regular movement to prevent constipations, and bowel should be in proper regular movement. Why? To prevent the constipations. Use of stool softener suppository may be administered as prescribed. Then you can also use the stool softener or the suppositories, whatever is prescribed by the physicians. General hygiene should be maintained. The general hygiene of the patient should be maintained. The oral hygiene should be provided every 3 to 4 hours. That is, the oral hygiene should be provided every 3 to 4 hours. Cleaning the skin with special care to the skin fold can prevent skin excoriations. Okay, so general hygiene should be maintained. The oral hygiene should be provided every 3 to 4 hours. Then you also have to make sure that while cleaning of the skin, you have to have a special considerations at the skin folds, because it can create skin excoriations. The sensory stimulations can be provided by touch, cuddling, music played at the bedside. And the sensory stimulations, it can be provided by with the help of any touch or cuddling or music being played at the bedside. Then as deformities should be prevented. What all are the deformities that the patient is having? It should be prevented. Proper body alignment with the careful positioning to facilitate drainage or the oral secretions, preventing pressures on the dependent extremities. The use of footboard can help to prevent the foot drops. Exercises with the normal range of motion of extremity should be given regularly to prevent the contractures of the joints. So we can say deformity should be prevented, and as well as proper body alignment with careful positioning should be prevented by for the drainage of the oral secretions or preventing any pressures on the particular extremities. And also you can use the footboard to prevent the foot drops. Okay, so next is urinary, we can say, elimination, which includes retentions and incontinence, assessment and its management. So urinary elimination, it is being defined as the expulsion of waste products from the body through the urinary system. Elimination from the urinary tract, it helps to remove the waste products from the body. So we can say, or we can define urinary elimination as those waste products which are being there in the body, and it is being excreted via urinary elimination from the urinary tracts to remove or the waste products from the body. That we used to call it as urinary elimination. So it is essential for the body's physical well-being, and this urinary elimination is very much essential. Why? For the body's physical well-being. Factors influencing urinary elimination. First is lifestyle. Many individual family and socio-cultural variables influence a person's normal voiding habits. For some individual, voiding is personal and a private act. So we can say first is a lifestyle, in which many individual families and we can say this cultural variables, they basically influence person normal voiding habits. For some person, voiding is a private and a personal act. Second is fluid and food intake. In which the healthy body, it maintains a sensitive balance between the amount of fluid ingested and the amount of fluid eliminated. So fluid and food intake, in which we can say our healthy body, it maintains a sensitive balance between the amount of fluid ingested as well as the amount of fluid that is being eliminated from our body. When the fluid intake increases, output also increases. So how much amount of fluid you are taking it, the output also increases, right? So that is fluid and food intake. Next is environment. During summer, due to excessive perspirations on the urine output is less. So we can say during the summer time there is not a lot of perspiration. So because of that, urine output is less. During winter, due to lack of perspirations, urine output is more. So we can say during winter, this due to lack of perspirations, the urine production is more. Next is psychological factors. Stress can also interfere with the ability to relax external urethral sphincter. As a result, emptying the bladder completely becomes difficulty or impossible. So we can say in psychological factors, the stress, it can also interfere with the ability to relax the external urethral sphincter. Why? As a result, emptying the bladder, it becomes completely difficult or impossible. Fifth is medications. Many medications interfere with normal urination process and may cause retention. So in medications, we can say there are many medications which basically interferes with the normal urinations and it can cause retentions. Example is furosemide. Okay. Next is 6th point is muscle tone and activity. People who exercise regularly will have a good muscle tone, increased body metabolisms and a good urine production. So we can say muscle tone and activity, we can say people who basically exercise regularly, they will be having a good muscle tone and thus in this way their metabolism also increases and there is having a good urine productions. Seventh is pathological condition. Endocrine disorders such as diabetes insipidus increases the urine formation. So we can say any endocrine disorders such as the diabetes insipidus, it basically increases the urine formations. That comes in the pathological conditions. Now, in this, the next is alteration in the urinary elimination. So, the first is polyuria. What does the word polyuria refers to? The polyuria. Poly means many. So, we can say polyuresis or the diuresis, it refers to the production of abnormally large amount of urine by the kidney, about 2500 ml or per day. So, we can say polyuria or diuresis, it basically refers to the production that is abnormally large amount of urine by the kidney, that is about 2500 milliliter or more per day. That we used to say polyuria. Second is oliguria. Oliguria means less, scanty. So it refers to voiding scanty amount of urine such as 100 to 500 ml per day. Okay, so in oliguria, it refers to the voiding that is scanty amount of urine such as 100 to 500 ml per day, that we used to say oliguria. Next is anuria. Anuria, it refers to voiding less than 100 ml per day. That is anuria, it refers to that stage in which we are voiding less than 100 ml per day, that refers to as anuria. Nocturia, it is an increased frequency at night, that is the urine at the night time is called as the nocturia. It is an increased frequency at night. That is not the result of an increase in fluid intake. It is expressed in terms of number of times the person get out of the bed to void. That is how much time the person gets out of the bed to void at the bedtime, that we used to say nocturia. So polyuria refers to, that is the abnormally large amount of urine production by the kidney, basically 2500 ml or more per day. That refers to polyuria. Oliguria. Oliguria means that is the voiding scanty amount of urine such as 100 to 500 ml per day. That refers to oliguria. Anuria. Anuria, that is, it refers to voiding less than 100 ml per day. Then is nocturia. Nocturia means increased frequency at night. That we used to say nocturia. Next is dasuria. Dasuria means, it means voiding that is either painful or difficult. Dasuria means, in this the voiding, it can be either painful or it can be difficult. It can be caused by stricture of urethra, urinary infections and injury to the bladder of urethra. So we can say in this the voiding will be painful and difficult. And why it is being so? Because it is being caused by the stricture of the urethra, any urinary infections and injury to the bladder of the urethra. Next is Enerosis. Enerosis, it is defined as the repeated involuntary urination in children beyond 4 to 5 years of age. So we can say Enerosis, it is defined as the repeated involuntary urinations in children, that is beyond 4 years or 5 years of age, when the voluntary bladder control is normally acquired, when they achieve the voluntary bladder control. Enerosis can be nocturnal, nighttime, and diurnal can be both. So this aneurosis phase, we can say there is repeated urination, involuntary urinations in those children who are beyond 4 to 5 years of age, when they have achieved their voluntary bladder control, and they also have some type aneurosis, that is it can be nocturnal or it can be diurnal. Nocturnal, that is during the night term, and diurnal, that is at the daytime or both. 7th is heritancy. Heritancy, it is defined as a delay or difficulty initiating in voiding. That is heritancy, it refers to those states in which the person is having delay or difficulty initiating the voiding. Okay, 8th is urinary incontinence. It is the inability to control passage of urine to continence, may be caused by stress. So we can say in urinary incontinence, we can say it is the ability, that is to control passage of the urine. Why? It may be continence, it can be caused by the stress. Next is urinary retention. It is the accumulation of urine in the bladder associated with inability of the bladder to empty itself. That is, we can say urinary retention. It is a stage in which the urine is accumulated in the bladder and the bladder is not able to we can say empty it. That stage we used to say urinary retentions. Okay, so these all are the alterations in the urinary elimination. The first is polyuria, second is Oligurium, third is Anuria, fourth is Nocturia, fifth is Dasuria, sixth is Enerosis, seventh is heritancy, eighth is urinary incontinence, and ninth is urinary retentions. So, in this we will be learning about urinary retentions. Now, what does the word urinary retention refers to? It is the inability of the bladder or to empty partially or completely during voiding. So, we can say in urinary retention, it is basically the inability of the bladder to either empty it partially or completely during voiding. That refers to urinary retention. So, what are the etiology of urinary retention? First is urinary urethral strictures. Second is neurological condition, that is it can be bladder failure to contract. Then third is medications. Fourth is obstructions like benign prostate hormones, BPH, calculi, blood clots, tumor, spinal anesthesia. So these all are the, we can say, the various etiology. So in this diagram you can say the normal flow and the restricted flow. Okay, so you can see this is a bladder, okay. So in which you can see this yellow color is a urine content, and this we can see it is a normal prostrates, and this is the pelvic floor muscles. This red color is pelvic floor muscles, and this lining is called as the urethra. So you can see in the normal flow, all the urine that is being collected in the bladder, it is being properly excreted by proper flow. That is, it is going down from here and it's crossing the normal prostrates, and then via urethra it is being getting discarded. Okay. What is happening in the restricted blood flow? You can see it is a bladder. This yellow color is a urine, but the prostate size is enlarged. Whereas in normal things, the prostate size was not enlarged. Whereas in restricted flow, the prostate size is enlarged. You can see here. And then you can see this is a pelvic floor and this is also urethra. So, because of this enlarged prostate, there is restrictions of the flow. As you can see, bit of urine is being excreted from the urethra. So, that is called as the restricted flow. That is, some problem or some abnormality has occurred. So, because of that, the urine has been restricted. So, that way is to say restricted flow. So, this diagrams, it usually conveys how a normal flow process and how a restricted flow process. What are the clinical manifestations of this urinary retention? So, first is distended bladder. Bladder will be distended. Residual urine volume is more. There is more amount of residual volume. Diagnostic assessment. The first thing is catheterizations. Second is cystoscopy. Okay. So, first catheterization should be done, and second is cystoscopy can be performed. Medical management, what all will be the medical management? First is you have to identify the causes. What are the basic causes of getting this urinary retention? Second is administer medication, example cholinergic medications. So, second is what you have to do is you have to administer the certain medications. For examples, cholinergic medications to stimulate. This all were the medical management. Now, what we can do in the surgical management? Urethroplasty can be done. That is the bladder neck repair surgery. Okay. So, urethroplasty can be done. That is, we call it as bladder neck repair. Suprapubic cystostomy can also be done. That is, a suprapubic cystostomy can also be performed. What all will be the nursing management? First is assess the urine output pattern. You have to assess the urine output pattern. That is, how much you are inputting in, how much amount of fluids you are taking in, whether it is being excreted limitedly or in more quantity. So, you just have to assess the urine output pattern. Second is observe for oliguria and anuria. You have to observe for the oliguria and the anuria. Third is percussion over the bladder produces a dull sound. Percussion over the bladder, it always produces a dull sound. Client experience increased discomfort and need to urinate. And what does the client feels? The client feels that there is discomfort and he feels to urinate. Implement measures to stimulate independent voiding, and then you have to implement certain measures to be provided so that the person can have an independent voiding. Then sixth you have to do is that provide privacy. Provide proper privacy to the patients. Place the patients in a comfortable positions, and then you have to place the patients in a comfortable positions. Warm bath on the perineum for the muscle relaxation, and then what you have to do is you have to warm the baths. It should be given on the perineum for the muscle relaxations. Apply ice or gently stroke in the inner thigh. What you can do is you can apply ice, or generally you can also stroke in the inner thigh. Relaxation therapy can be provided to the patients. Catheterizations of the client can be done. Prevent infections by proper hand washing technique. That is, if we do the proper hand washing, we can prevent this infection. Avoid backflow of urine. You can avoid the backflow of the urine. 14 is you have to prevent colonizations of bacteria. Colonization of bacteria refers to if more and more amount of urine is being there in the bladder, it is being not excreted, then the bacteria can make their home there. That is, you have to prevent that colonization of bacteria. Maintain patency of catheter. You also have to maintain the patency of the catheter. Encourage increased fluid intake. You have to encourage the increased fluid intake. And then prophylactic antibiotic can be given to the patients. So, these all are the, we can say, the nursing management for urinary retention. First is assess the urine output pattern. Observe for the oliguria and anuria. Percussion of the bladder, it produces a dull sound. Client experience a discomforts and need to urinate. Implement measures to independent voiding. 6th is provide privacy. 7th is you have to place the patient in a comfortable position. 8th is warm bath should be provided on the perineum for muscle relaxations. 9th is apply ice, or you can gently stroke the inner thigh. 10th is relaxation therapy can be provided. Catheterizations of the client can be done. Prevent infections by doing the proper hand washing techniques. Avoid backflow of urine. Prevent colonizations of the bacteria. Maintain the patency of the catheter. Encourage the fluid intake, and prophylactic antibiotic can be given. So, these all are the we can say management etiological causes of the urinary retentions. Next is urinary incontinence. So, urinary incontinence, it refers to involuntary loss of urine. Okay. So, why there is involuntary loss of urine? First, it can be related to stress incontinence. Because of stress, there is incontinence of urine. Urge incontinence, then overflow of incontinence. Excess of urine is being there in the bladder. Because of that, there is continence. And urge, it's urge voiding. It is being urged to void it. That is urge incontinence. So, urinary incontinence refers to involuntary loss of urine. It can be stress incontinence, it can be urge incontinence, and it can be overflow incontinence. So, what are the causes of this incontinence? First is anatomical defects. Any anatomical defects can also lead to urinary incontinence. Physical, physiological, and psychological. These three main causes we can consider, that is any physical defects, any physiological defects, or any psychological. Then pharmacological factor, because of certain medications also incontinence can happen. Clinical manifestation will be involuntary loss. Okay, you can see there is involuntary loss of urine. Diagnostic evaluations, we can say investigation, proper investigation should be done, ultrasonography, then catheterization and cystoscopy. So these are the various investigation methods by which we can confirm this urinary incontinence. Investigations, ultrasonography, catheterization and cystoscopy. Then management, first is you can do the pelvic muscle exercise, that is the Kegel exercises. Second is electric stimulations can be performed. Third is bladder training and behavioral training can be given to the patients. Monitor the fluid intake and dietary changes. You can monitor the fluid intake as well as the dietary changes. Reduce intake of water and avoid alcohol, chocolates and caffeinated drinks or soft drinks. So what you can do is you can reduce the intake of the water as well as you should avoid alcohol, chocolate or any caffeinated drinks or soft drinks. Develop voiding schedule, that is you can schedule at this time you will be voiding it, so you can have a habit of all this thing, that is you can develop the voiding schedule. Counseling, proper counseling can be given to these kind of patients. So what all are the management? First is pelvic muscles exercises, then electric stimulations, bladder training and behavioral training, monitor the fluid intake and dietary changes, reduce intake of water or avoid alcohol, chocolate and caffeinated drinks or soft drinks, develop voiding schedules and counseling. Next topic is functioning of sensory organs, which includes visual and hearing impairment. Okay. So specific sensory receptors are contained in specific sense organ. Each of the 5 senses has a specific sense organ associated with it. The most familiar sense organ are the eyes, ear, nose, skin and taste buds. So we can say our body is also having specific sensory receptors in our body, which are basically associated, this types of specific sense organs should be associated with that organ only. So the most familiar we can say the sense organ are our eyes, ear, nose, skin and taste buds. These organs have receptors that can respond to stimuli by producing nerve impulses in a sensory neuron. So in this, first is blindness. What does blindness refers to? Absolute blindness is the absence of light perception, that is the person is not able to perceive the light. That is absolute blindness in the absence of light perception. What are the causes? Visual impairment among adult of 40 years of age. First is visual impairment in adult, we can say of 40 years of age. Diabetic retinopathy, any person who is diabetic, that is diabetic retinopathy. Muscular degeneration will be there. Glaucoma and cataract. So these all are the causes of blindness. It can be visual impairment among adults 40 years of age, diabetic retinopathy, muscular degenerations, then glaucoma and cataract. Clinical features will be visual impairment, then genetic abnormality because of any fluctuating visual acuity or general acuity problems will be the clinical features. What will be the nursing management of this blindness? It is important to determine the patient's visual impairment. We should determine why the person is having blindness. That is to determine the patient visual impairment. Second is the nurse should determine how the patient visual impairment affect the normal functioning. That is the patient generally, the person or nurse should determine how a patient visual impairment it affects the normal functioning. The nurse may ask the patient how much difficulty doses the patient while reading and writing, and this patient, this nurse can ask the patient how much difficulty the person is facing while reading or writing. So this was all related to blindness. Second is deafness. Deafness means it is the impairment of hearing when the person is not able to hear. Classifications in this conductive deafness is there due to defect in the conductive mechanism of the ear. Conductive deafness is due to there is defect in the conductive mechanism of the ear. Second is sensorineural defects. Deafness due to vision lesion in the labyrinth, aids nerve or the central connection. So we can say the sensorineural deafness, it is why it occurs due to lesion in the labyrinth glands, aid nerve or central contractions. central connections. Third is mixed deafness. It is a combination of conductive and sensorineural types. So, it is basically a combinations of the conductive and sensorineural types. The first is conductive deafness, second is sensorineural deafness, and third is mixed deafness. This is a picture of the hearing impairment patients. Okay. Next is assessment of hearing, in which two tests are being done, Rennie's test and Weber's test. Rennie's test, a vibrating tuning fork is placed on the mastoid process of the patients, in which a vibrating tuning fork is placed on the mastoid process of the patient, and instruct him to tell the clinician when he stop hearing, and then you have to instruct the clinician when he will be stop hearing. Immediately bring the tuning fork close to the ear and ask whether he can hear the vibrations now, and then you have to vibrate. You have to immediately bring that tuning fork close to the ear, and then you have to ask the patient whether the patient is able to hear that vibration sound. Normally the person can hear it. This is because air conduction of sound is better than bone conduction. Why? Because the sound of air conduction is more better than bone conduction. This is called Rennie's positive, which is normal test. In conduction deafness, bone conduction is better than air conduction. In conduction deafness, if the person is having, in which bone conduction is better than the air conduction, that we call it as Rennie's negative test. So, Rennie's test, in which a vibrating tuning fork is basically placed on the mastoid process of the patients, and then you have to instruct him to tell the clinician when he stop hearing. So, immediately you have to bring that vibrating tuning fork close to the ear, and you have to ask the patient whether he is able to hear that vibration sound. Normally the person can hear that vibration sound, that we used to say Rennie's positive test. In case the person is not able to hear it, then it is Rennie's negative test. That is, the bone conduction is better than the air conduction. In neural deafness, both air and bone conduction are decreased, whereas in neural deafness, both this air as well as the bone conduction are decreased, but still air conduction is better than the bone conduction, that is reduced Rennie positive. Second test is Weber's test. A vibrating tuning fork is kept over the vertex or the forehead of the subject, in which this vibrating tuning fork is basically kept on the vertex or the forehead of the subject. Normally he can hear the vibration in both ears. Normally he can hear the vibrations in both the ears equally. In conduction deafness, it is better heard in the affected ear or Weber's lateralized to the affected ear. So, in this conduction deafness, it is basically heard in the affected ear, and the Weber is lateralized to the affected ear. In neuronal deafness, it is heard better in the normal ear or Weber's lateralized to the normal ear. So, you can see in this picture, this is a Weber's and the Rennie's test. This Weber's test, this tuning fork is placed on the middle of the forehead, that is, this is at conductive loss, same ear or sensorineural opposite ear. Whereas in Rennie's test, this vibrating tuning fork is placed on the side of the ear, that is, this is the air conduction, this is the bone conduction, which is being kept at the mastoid process. Okay.
So, what will be the management of hearing impaired child? Successful management of an impaired hearing children lies in early diagnosis. That is, we can say, if we want to need a correct impairment, so we need to diagnose it early. It is important to determine the type of hearing defect. That is, we want to know what type of a hearing defect does the child is having or does that person is having. Why? So that we can early diagnose the main causes and accordingly we can provide the specific treatment. So, conduction hearing loss can be treated both medically and surgically. So, we can say this hearing loss problem can be treated both surgically also as well as medically also. Sensory neural defect treated in a team approach, it includes physician, audiologist and speech therapist. So, we can say this sensorineural defects. To treat all these defects, we need a team. So, in team, it includes basically the physicians, the audiologist and a speech therapist. These are the person included in this. If we want to treat any defects, so we need a teamwork. So, for that, these all are the team we require to treat a particular, we can say, hearing impaired children. Speech therapy has a useful role to play in the training of partially deaf children, and this form of services should be utilized. So, we can say the speech therapy it is really very beneficial if we provide at a suitable time. we can say speech therapist is given to those children who are facing trouble to speak. So if we start speech therapy at a correct time, the children will be getting benefited. So it is basically a good training for partially deaf children, and this form of service should be utilized. Then again, one more nursing management will be coming is nursing management include assisting with early detections, providing emotional support and educations for family members, assisting with corrective measures. That is, we can more include in the management is, first is assist with early detections. That is very much needed. We have to detect the main causes or what are the factors because of that has happened. That is assisting with early detection. Providing emotional support. Providing emotional support refers to, that is, we are providing a warm and concerning, we can say, way to approach to a client. And education for our family members. Proper education to be given to the family members regarding what is the diagnosis, what kind of a disease is, whether these defects can be cured, or what are our supports that we can provide to the clients as well as to children. Assisting with corrective measures, that is, what are the corrective measures required after the diagnosis of particular diseases. We can say what are the managements being included in. So these all are the managements for the hearing impairment. So we can revise it by saying successful management of impaired hearing children lies in early diagnosis. It is important to determine the type of hearing defect. Second is conduction hearing loss can be treated both medically and surgically. Sensory neural tube defects treated, it's basically treated in a team approach which includes the physicians, the audiologist and the speech therapist. Then speech therapy has a very useful role to play in the training of a partially deaf children, and this form of service should be utilized. Then nursing management, it basically includes, first point, assisting with early detection. Second is providing an emotional support. Third is educations for the family members and assisting with the corrective measures.